How patients move through general practice is going to be an increasing focus for 2026. And in this episode, I'm really happy to be joined by the team from Exon Health as they talk about their intelligent care navigation system and how that can help patients navigate through your practice, your network, your healthcare pathway to help them and also manage the workload for you in general practice. So let's crack on as we tech enhance your primary care and learning. Hello, eGPlearners. Welcome to this episode where we're talking about everything Exon Health and their intelligent care navigation system that is an offer to you as practices to help your patients in primary care. And for this episode, we've got Max joining us from Exon Health. How are you doing there, Max?
Very good, Hussein. Very good. Thank you. Good to be here again.
Yeah, definitely. Great to have you back on the channel. So you've been here a couple of times in various different guises and systems and stuff. But I know today we're talking about what Exon Health can offer general practice out there. Do you want to give us just a quick summary of what you do and how you've been doing things?
Yeah, absolutely. So, of course, at Exon Health, we provide the telephony system into over half of general practice across the UK at the moment, and that's Surgery Connect. What we've been working on over the last few months or years is building out from that core base. And we know that the large bulk of patients contact their GP surgery via the phone, but actually it's what happens after that, or how do we deliver equitable access in terms of accessing via other digital routes. So if you cast your mind back a couple of years to the DFOC VC framework, of course, the Better Purchasing Framework and now the Digital Pathways Framework, there's lots of different ways that patients can access the surgery. And if you think about the 10-year plan and the three core pillars of moving from hospital to community and sickness to prevention, it's really how do we help support not only our patients and our citizens, but also our staff and workforce to work through that.
Definitely. And I know that's been a key focus, particularly over the past few months. Obviously, many practices have shifted towards that 8 till 6:30 opening times and responsiveness that practices are having to deal with. And then with that, there's that aspect, I guess, potentially is that unmet need that many people have as well in terms of what happens outside of the core hours of general practice. How do you manage some of that? Because even though that is technically out of hours domain, practices are still having to receive some of the workload from there. And I guess what does that look like moving forward as the expectations of general practice moves towards various different aspects, primary care, networks, neighborhoods, etc. And I know that you guys are going to show some cool things that have developed to try and help practices do that, aren't you?
Absolutely. And that's the thing, that the service is already there, right? PCNs were established a few years ago now, and it's just better utilization of those services that we need to support. And if that means connecting a patient directly to that service, regardless of the day of the week or time of the day, then we should be able to do that. So yeah, hopefully we'll be able to showcase how we're doing that at Exon Health today.
Awesome. So what we're going to do, eGPlearners, we're just going to go through a few of the things that Max has got to show us in terms of what Exon Health and the various different aspects of Surgery Connect, Intellect, Assist, and Insights can offer. I've got them all there. And then we're absolutely going to give you the opportunity to ask questions as well. I'm keen that you do so. So make sure you stick those in the chat and we'll be able to come back to them throughout the session as well. So Max, the floor is yours. Screen's up. Off you go.
Thank you very much for saying. So yeah, we've got lots of different tools that we're bringing together to ensure that we can deliver not only equitable access for patients and how they submit those requests, but actually how they're received into the surgery. And we've coined the term intelligent care navigation. And I'll put a diagram up on screen. I don't expect everybody to be able to study this and follow this in its first instance. So there is a QR code there for anybody to scan. And we do have a link that I'll pop into the chat as well. But it's all about equitable access and helping the patient get to the right place first time in a way that they need it. And it's a phrase I've been saying more and more at Exon Health over the last few months, is that we're beyond right service first time. It should be right service first time, how the patient needs it. And we'll, over the next kind of half an hour to 45 minutes, hopefully we'll show that and open for questions at the end. I have added, we may not get time to cover Surgery Insights in depth today. I have added at the bottom here at the end of that journey that we do constantly evaluate all of the data, whether it's around access, the capacity in the surgery, or levels of demand. We always monitor those metrics within Surgery Insights, and of course share them with general practice, PCNs, ICBs and regions to help them iterate on their pathways to make sure that patients have a successful journey. We will do a follow-up session on that, so please do follow Exon Health as well across our socials, because we will be hosting some webinars on specific pieces of the intelligent care navigation system. So just to break down the four components, Hussein, you did remember them all correctly. So first off, we have Surgery Connect, lots of features that have been built over several years that are already being utilized by practice teams and patients. We've got a couple of additional features that we'll be looking at today in terms of our voice agent, our Omni-Consultation concept, and of course, appointment booking invitations. Surgery Assist is the patient-facing natural language signposting tool. So we spoke a little bit about accessing services 24/7. We'll run through that as well today. Surgery Intellect sits in the consulting room as an ambient voice technology to support clinicians to note take, summarize, and also code right back to the record. So we'll show a bit of that today. And of course, the post-consultation activities within the admin teams, referral letters, patient communications, that's all supported within Surgery Intellect as well. And Surgery Insights, we really do hope to get to that today. So just to recap on the bits we will touch on in this hour, voice agents, so inbound, we won't touch too much on outbound. They're coming slightly later in the year. So again, do keep tuned for when we for more announcements. The Omni-Consult concept, so this is the only voice and text-based consultation system in primary care at the moment. So super excited to spend at least 10 minutes on that today. Appointment booking, so actually when a patient submits a request, how are we responding to that from within the surgery? And over with Assist, we'll look at submitting online consultations through text, appointment booking from a patient perspective, and again, we'll touch on Intellect, hopefully with a good 15 minutes at the end.
Mm-hmm.
So the way in which we do that, so what is Intelligent Care Navigation System and how do we deploy that within our care setting? One thing that we want to do is absolutely, as you said, Hussein, it's about understanding the demand that's coming in and filtering out what's unnecessary. And what I mean by that is if you build a localized model that understands services that you have locally, you can help automatically signpost patients to those services. So you might think of a smoking cessation service, you could think of a health and wellbeing coach within the PCN, or it may be self-care and advice or prescription ordering through the NHS app. Whatever it is, we need to build in pathways where the patient can get automatically signposted. Once we've filtered out that unnecessary demand and we are increasing the appropriateness of the demand coming into general practice, we then need to prioritize the workflows and how they come in. And we do that through our unified phone bar within Surgery Connect. And that's really managing all of the requests, regardless of how the patient submits them, into one single workflow and interface in the practice. Of course, to do that, what we want to do is ensure we have equity of access for patients. We talk a lot about edge cases with disabled patients, hard of hearing, visually impaired. But what I really want to discuss today is about all of our patients and citizens' temporary inabilities. That might be the fact that you're driving, so you can't use our chatbot, for example, or you may be in a public space where you don't want to speak out loudly, so you might use the chatbot instead. So it's not just about disabled patients, it's also about the temporarily unable patients. Once we've got the requests coming into the surgery, it's then how we manage them and communicate back with patients. And of course, going back with Exon Health's very first beginnings, we are a communication platform, so we can utilize all of the Exon Health integrations and communication methods from a single interface to respond back to those requests if necessary. And of course, if we do invite them in for an appointment, whether that's on the telephone, in the consulting room, how do we then streamline that clinical pathway or the consultation that the GP will hold with the patient using ambient voice technology? So what we'll do with the Intelligent Care Navigation is we're going to close the whole circle of a patient interacting initially with their GP surgery, whether that's automated through a website, through a phone, how that request comes in, how it's handled by your teams in a unified way, and of course, how we support clinicians as well through that consultation. Firstly, we'll start with Assist. So Assist is your layer of protection. It's true demand management. This is not about moving demand to another channel. This is about signposting and looking at the data, 30 to 40% of that demand automatically around your GP services. So thinking back to the first point about filtering out unnecessary demand, this is exactly where Surgery Assist will sit. So as your demand comes in, be met with Surgery Assist, it will protect the capacity and signpost it into that community service, PCN service, or self-service. So what I'd like to do first off is show you how we would automatically signpost 24/7. So in a moment, you should see my phone on screen. We're going live here. So if I just quickly open up, what we're going to demo today is automated signposting. So if I move into one of my digital assistants where we have Aria here, and what I'll do is I'll jump straight into the free text interface. So it leverages some natural language processing within the Ask a Question feature, and we'll do some quick data governance checks that the patient are happy to proceed to the free text element of the Surgery Assist chatbot. And if let's type in losing weight, and I'm hoping that Aria will come back and just qualify exactly what I mean by losing weight, what is the specific patient intent. And in this case, I want to lose weight as a patient. Again, I could be typing this in at 9 p.m. on a Thursday, 10 a.m. on a Sunday. And as you can see, ARIA has been pre-trained locally with a PCN service. And if I click that link, I'm then referred to the PCN Health and Wellbeing Service, and I can refer myself straight into that service. So this is an example of how Surgery Assist will do automated signposting 24/7. So the first part of that intelligent care navigation that we talked about in slide 3, removing all of the inappropriate demand that's coming through general practice, this is exactly where Surgery Assist would sit. The next example I'd like to give is enabling appropriate demand. So you may have seen where ARIA wanted to just double check what I meant. So in the initial example, I wanted to lose weight, but in this example, I've lost weight unexpectedly. And where ARIA will understand the intent from the patient, yes, that deserves to be submitted to the GP practice for review. So if I click the link to submit an online consultation request, as per the flow here, shown on the right-hand side, that will take me through to the online consultation tool within the surgery, and I would submit that request. Now, one thing to note here, Hussein, you mentioned about 24/7 signposting and which time of day and day of the week do we do that. Of course, clinical requests coming through online consultations will close due to the 1st of October contract changes. That's 8 till 6:30. The beautiful thing about using technology is it does know the time of day and the day of the week. So we use something called time-based criteria routing to make sure we go to the right service at the right time for the patient. Okay, and that includes 6:30 till 8 to go to enhanced access hubs as well that we can build into it. Now, the next example I want to give is something very new, and this kind of moves us on to the Omni-Consult concept or platform that we're delivering now. And what I will showcase using Misha is another digital system that we've built. Again, these are all localized to you in general practice, so your patient finds a bit of an affinity with the digital assistant. So clicking through to the Ask a Question feature again, in this example, if I suggest that I found a lump on my breast, for example, of course, according to the flow behind, Misha should be signposted straight through to the Omni-Consultation platform. And if I click that link there, this is where we do a quick cybersecurity check to make sure there's no bots using the chat bot. And again, we come through to a medical request form. And as a patient, I can then come through. And the reason I'm going to fill this in live is because I'm going to show you how it's received into the surgery, which is one of the main parts of the intelligent care navigation system. So if I suggest I found a lump and it's sore, and I just found it. And there's a reason I'm showing you a text-based submission, and we'll show a voice-based submission as well in a moment. See a GP and a scan. Let's do that as a request. And we'll go with any time to be contacted. And we'll give the patient a summary of the request they're trying to make, and we'll submit that into the surgery. I just wanted to check so far, Hussein, has there been any questions that have popped into the chat?
Not at this point, but what you have shown is, like I said, is that clear flow of the stuff, way that the information's come into things so that people can see that, how that's flowing through in terms of the practice. And then obviously, hopefully we're now going to see what that looks like for the practice team in terms of the outputs and stuff that they've got. Yeah,
absolutely. So launching from the phone bar, let me know if you can see my screen.
Yeah, just coming on now.
Fantastic. So I'm using EMIS in the background as my clinical system today, and I've got the Surgery Connect phone bar that overlays that, and you can see my communication window here that I can launch. And if I go to my forms inbox, I can see my medical request form that's come in, and I've got that there. And part of this flow now is this is our Omni-Consult inbox, or our forms inbox, and I'll speak a little bit later about how we're expanding on these forms that can be submitted with customized question sets and so on. But ultimately, we have the waiting list here, and I can read the request from the patient, and I can then triage or process that request that comes through. Now, that's the second part and the third part actually that we've covered of the intelligent care navigation system. So the patient has been enabled to not only we verify that the patient's request belongs in general practice. It didn't belong in the community or PCN service. This should come through to the GP staff. And then the third part is effectively and efficiently communicating back to the patient. And as we can see here, I can call the patient back. And if I click call to call that patient, it's going to call directly from Surgery Connect. And again, in my activity, in my notes, it logs the fact that that call has been made. So we've got complete integration between all of these systems. If I deem it necessary to invite the patient in for an appointment, I can also click to send a message to the patient. I can pull in a template. And again, I can add a booking link to invite that patient in as well, in which that will then text the link to the patient and invite them in for an appointment. So what you've just seen there is a patient coming through Surgery Assist. Surgery Assist as your layer of protection and kind of care navigation, automated care navigation tool, is understanding the intent from the patient, recognizing that in this scenario, it does require a submission into the surgery. And then actually when that comes into the surgery, the staff can respond to that very quickly and actively to the patient. Now, one thing that I won't demo live on the call today, but one thing that I did do earlier in classic Blue Peter style, if I just go down to the other request I submitted this morning, this is through our voice agent that we launched as well. So the other half of Omni-Consult is, yes, we have text and web-based submissions. The reason we called it Omni-Consult is because it's absolutely, completely omni-channel. So if a patient calls into the surgery, they can complete the same form, but using their voice. And one clear distinction you'll notice between the two submissions is that this is much more rich. This has come directly from the patient with their voice. One of the questions that we get or issues that we get raised from GPs is that, you know, we've moved to the total triage model and the front of staff, or you may be like my grandmother who has arthritis. She was asked to submit a request online, and it was painful to do on her small little smart device. So she was very limited in the amount of information she gave. If she was able to call into the surgery and complete the form via voice, you would have got a much more rich submission. And what that does is it improves the efficiency of the workforce within the surgery, and it negates the need to call the patient back and get more information, because you should have a full understanding of what that patient submitted. There's a few little extra additions to the interface here. So you can see in the top right that we do let you know that this was submitted via voice agent. And again, we store the full recording there as well. So if there's anything you don't understand within the transcription, you can listen again to it. And you've got all of the same follow-up actions to call the patient back, to text the patient, request a photo, or even start a video call with them. And again, we've got the full actions that come from that as well. So you could assign that to any team or individual within the surgery to hand it over, and also SNOMED codes. So I won't click through the full process here just due to time constraints, but of course, more than happy to meet any surgeries one-to-one to discuss how this would work specifically for them. But hopefully that shows how going back to the initial slide, we've shown how we can filter out unnecessary demand in general practice, allowing us to get through more of the demand that we have. As saying, you use the correct terminology in terms of the unmet demand and how we meet it. That's exactly how we do it. If we can filter out 30 to 40% of the demand automatically, 24/7, in and out of hours, it allows more requests that come through that are appropriate for us to then be responded to. By doing that, we can then invite them in for an appointment and book that in with them. And then what I'm going to show you next is the clinical consultation side of it with Surgery Intellect. And I'll pause there, Hussein, if there's any questions that popped up, or if you've got anything that you wanted to touch on.
So we have had a couple of questions come in from various different places. So I'm going to try my best, because this is now fully multi-channel. So we've had, and although I can't bring this one on screen because it's on our Instagram and it does things slightly differently there. So Arjuna was asking about whether or not does this mean that Exxon are doing effectively an AI virtual receptionist. You call it voice agents. I guess people may call it a voice receptionist. Is that correct?
Yeah, I think the stance at Exxon Health is that we appreciate what receptionists do, and there's a lot more than just answering calls and filling in forms. So we've kind of avoided going down the route of claiming that we have an AI receptionist that does everything you need it to do. We're not there yet. We know that the technology is there yet to do that safely, or at least as much as we'd like it to be safe and secure. So towards the end of the demonstration today, I will go into what's coming. So we started with the kind of the consultations or the data collection agent, and certainly we'll be delivering or deploying more and more agents as we go throughout the year. This is absolutely the year of the voice agent. We had our product director Melissa Latto and Lucy Glynn ran a webinar last week on what is coming in terms of this year and our voice agents that we're building out to build that full suite to support your workflows. I will put a link in that. I have put a link in the chat, I think, where you can go back and watch that for half an hour. So to answer the question, yes, we're playing in that market. I think it is the right way to say it, but we don't believe that we're right there to claim that we have an AI receptionist. We can absolutely plug and play our voice agents in throughout your X flow, your call flow, to ensure that you have not only patient choice, but equity of access as well.
Awesome. And then the other question I'm going to go to before we carry on. So this is from Ketan Bhatt, who's joined us from LinkedIn. So, again, full multi-channel and stuff. So a lot of practices are wedded to systems such as Accurate eConsult already. Are there any plans to integrate this with those services as part of the total triage? And I guess similar to the question we have from Kashaf, who's asked about, how does this integrate with other platforms that may be offering similar things? You showed us the form that you used, and obviously that did, by the looks of it, integrate with one of the platforms, Accurate and stuff. But how does your form integrate and differ from those?
I think, yes, I'll share my other screen again, because I think this is a really kind of pertinent point at the moment in terms of how we integrate. And for us, clinical safety is the priority for us. And when you're taking a voice agent submission, anything could happen to that call regardless of the patient's problem. So we need to be absolutely sure that if the call does drop out while they're submitting that form, we catch that in a safe and secure way that you could then follow up with. So on screen, you'll see I've got this incomplete window in my inbox here. I've got a couple here that have basically not been fully answered by the voice agent. And really the difference between us and the other solutions is that because we have the phone system as well as Omni-Consult and the voice agents as well as Assist all in one place, we can track that patient journey, which means that if there's any disruption or break in that patient's journey, we can pick it up and follow it up to make sure it's followed up. So the limitation, of course, from a technical perspective, we can and have proof that we can integrate with the other suppliers, but until we can guarantee that if a voice call was dropped halfway through that consultation or that submission, we won't deploy it to the 35 to 40 million patients that use our service every month. So what we have within our platform is an incomplete window where any voice submission that's completed with our voice agent is captured with the recording and the ability to follow up with that patient to make sure they're okay and that you can finish off the submission with them. And I think that's a really key difference between the two systems.
Okay, so that's the voice agent. Your text agent, does that integrate with the other platforms that exist in terms of the total triage side of things, or is that a separate module as well?
So the text interface is ultimately it's the same as the voice form. So in order to have the voice agent submissions come into an inbox, we needed to create, of course, using speech to text and text to speech, we needed to create written forms anyway. So what we do is we just generate a URL that you could surface throughout your patient journeys and on your website. The patients would submit it. So it's almost to replace those as opposed to integrate with those from a text-based perspective.
Got you. Okay, thank you for that. Right, let's move on to the next part that we were going to cover. So we're just waiting for that to load up. And again, if you've got questions that you want to ask when you're watching this, feel free to stick them in. We will come back to them. If not at the time, a little bit later and stuff as we cover some of this content and stuff. So carry on, Max.
Lovely, thank you. So talking about the intelligent care navigation system process again, just to highlight it. So Surgery Assist will filter out unnecessary demand coming into your surgery. Omni-Consult and the workflow agents that we're building out throughout the year will help you not only receive those requests into a unified interface launched from your phone bar, but also offers equity of access for patients to submit via voice and text. Then, of course, our communication platform in terms of texting the patient back or calling them, inviting them in for appointments. So the last part of that intelligent care navigation system process, if you like, is the consultation. So we've invited the patient in, and now we're in the consulting room with the GP and the patient, or we're doing it over the telephone. And we can talk lots about the USP around why we're a telephony company, and we've partnered with the highest clinical grade AVT in the market with Tortoise, is that, of course, we know that 30% of consultations take place over the telephone, and we actually can transcribe, summarize and code every conversation, whether it's in the consulting room, through your soft phone in the phone bar, or, this is a key part for GPs, or on your hard phone that's on your desk. So we will pick that up, capture it, and automatically give you the notes for that as well.
Okay.
So we can transcribe more of those consultations. And Surgery Intellect, as well as all of the other features we talked about today, can be launched from the phone bar. And again, by click of a button, we can transcribe that call and have a full consultation. Once the consultation is done, we can add context. So if the patient appeared, fidgety, sweaty, kind of non-verbal cues, if you like, to add context to the consultation, you can absolutely do that, and that'll be passed through to support the notes that are taken. We break down the notes to suit either EMIS structure or System 1 structure. And I should add that we have integrated with Medicus, so this solution is also available with those Medicus surgeries as well. Once we come through, the GP would obviously go through and read the notes, can make amendments within that process, and we can file that to the record as well. Where the SNOMED codes take place, it will automatically code. It will advise on codes that it's pulled out from the conversation and suggest which codes you can, so let's just skip forward there, which codes you can file back to the record. You can toggle on or toggle off, you can edit. So if you said they're around a certain height, for example, it won't have that toggled on, and it will actually ask you to specify what that is to be filed to the record.
Okay.
After the consultation, so we've the AVT product in Surgery Intellect powered by Tortoise has taken your notes, it's written your notes for you, it's pulled out all the SNOMED codes. Once you've confirmed those, you can then generate, so whether this is the GP or the admin staff, and we think about that post-consultation activity, it will then create specialist referral forms for you or patient-facing communications that you like. And as you can see on screen, that's all formulated from the consultation that took place that can then be sent to the Onward Care service or to the patient, of course. So the news, I think, announced last month, is that we now have a simple one-click file to record for both EMIS and System 1. So from the Surgery Intellect interface, one click of a button, and it will be filed in, as you can see on the right-hand side, into the appropriate structures into your clinical system as well.
I'm just going to make that bigger so people can see that, although I appreciate it's still a little bit small, so definitely watch on a desktop screen. Alternately, I know that we covered some of this in the webinar that we did in terms of comparing the AVT tools last month 2 months ago now. Time flies in December. So feel free to watch that, where Melissa went through a lot of that product tools with Dom from Tortoise as well.
Yeah, absolutely. And I will take the time to say at the moment we are still offering a 3-month free trial of Surgery Intellect. So if you are using Surgery Connect and you're using EMIS, TPP or Medicus, there is a 3-month free trial to have this deployed. I believe at the moment we're deploying within about a week or two, so it's very quick to get set up. So yeah, anybody that is interested, we've got the free trial form. I don't know if it's been popped in the chat or it's available on our website. There will be a form at the end of the webinar that we'll share in the chat for you to submit your register your interest for any of these tools.
Mm-hmm.
So lastly, appreciate some people may have had the pleasure to join the webinar last week that was hosted by Lucy Glynn and featured Melissa Latto, our product director at Exxon Health, but also Patrick Denston from Alexander House in Frimley, who is already using the Omni-Consult with our voice agent. They discussed within that webinar the year ahead, so the future of the voice agent and what that means to general practice. And I've rather cheekily pulled out those agents that might come. So I've taken this slide from the webinar last week, and they do cover it far more extensively in the webinar. So I'll pop a link in the chat if anybody does have time to watch that. So today we covered off the online consultation collection agent. What's coming next is the appointment reminder, book, check and cancel agent. And again, we've got the Surgery Assist agent coming in Q2 of this year. Surgery Assistant is the voice version of Surgery Assist. So Surgery Assist has all of your localized signposting services. We're currently deploying every Surgery Assist chatbot with about 600 FAQs within it, but because of our supervised iterative training of every single digital assistant, you may have after 6 months 1,000 to 2,000 frequently asked questions available in your chatbot, but then also made available via voice as well. And where we see that sitting is ahead of your other agents. And I'll go back to the slide where we look at the Xflow and how we build these in.
Can I just clarify that bit with you then, Max? So what you're saying is Surgery Assistant is a voice agent version of the text-based Surgery Assist that will be responsive with patients when they wanted to call your practice. Is that correct?
That's absolutely correct. Yes, we're building it. It'll be coming in Q2. Just to put that into a bit of images for people to understand. So if you think of the inbound demand that's coming into your surgery, at the moment, they are met by Surgery Assist, whether that's the chatbot or your website. And then soon we'll be deploying the same training data via voice. So we've got the list of FAQs that might be available within your surgery, and we call this hyperlocalization. So every FAQ that we have, yes, there'll be some common across the country, and we have those. There's about 500 of those. We've got partnerships with Drink Aware. We're speaking with Age UK in mind to put that verified information in there. But the real power then comes within the hyperlocalization. So we monitor every input that a patient would put in, and if the digital assistant or your digital assistant doesn't have an answer to that, of course, we're not going to go out to the World Wide Web and just respond. We do say that we don't have an answer for it, but what we do is we log that as a UAQ, and we call that a unique asked question. So the work that we do with you, and this is why the customer success team is the largest team in the company at the moment, we understand the nuance of general practice. We want to meet you on a monthly basis to make sure all of your intelligent care navigation features are aligned and working together to make sure that the patient has a successful journey. What we will do in that meeting that we have with you is look at your list of UAQs. So what couldn't your digital assistant answer that your patients wanted to ask last month? We will manually upload more and more UAQs, flipping them into FAQs. So you'll have a big bank of training data or knowledge that's local to your surgery. So think of, you've got a blood pressure check machine in the waiting room. Your surgery assist chatbot will need to know that, and it will know that. It will know whether you've got drug addiction support services locally, which is an example we ran through last week. But ultimately, you get true equity of access and kind of not continuity of care, but more consistency of care, regardless of the channel or mode that your patients interact with your surgery, whether that is via chat, whether that's via voice, or whether it's via your website. And that's really the crux of intelligent care navigation. Intelligent care navigation. It's not only offering the patient to submit the request any way that they want, managing the demand, so filtering out what's unnecessary for general practice, and bringing it all into one unified workflow and the interface that we showed from the phone bar.
Okay, so just so I understand that clearly, and for everybody else out there watching us live and stuff, so you have the hyper focus aspect. So that, say for example, a patient wants to look at drug misuse cessation, and that will then allow the practice through the system to signpost to the local service that provides them that care. But say for example, like this week, which is Cancer Awareness Week, there may be a spike in terms of requests for particular services. Say, for example, prostate cancer awareness. You will see that spike. That will come through as UAQs, which then can be developed as an FAQ to then hyper-focus, link to the local services to provide that information on the back end of that kind of spike that you've got as a result of it. Is that pretty much what you're saying?
That's absolutely right, Hussein. And actually, a working example from last week was in a specific surgery. We had 2 requests for supporting coming off ketamine, and we reviewed this data with the surgery, and we said, "Oh, we actually didn't have a response to a patient that asked that within your chatbot. So we better write a response and signpost them to the appropriate service. We can also offer them to come into the surgery if that's the pathway that the surgery wants." But we went one step further, and we actually contacted the local drug addiction support service, and we asked them, "Are you getting many requests for ketamine?" And actually, it turned out they were. So what we did then is, with the surgery and that service, we put together some collateral where we could do some outbound communications into the community, because we recognized essentially that there was kind of a burgeoning issue of ketamine addiction in that local area, and we could be proactive and preventative towards that and get patients and citizens the support they needed, just from understanding the data a bit better.
And I guess not only with that, not in terms of signposting to other services, you can clearly also use that to signpost to services that the practice may be providing. I'm thinking, minor surgeries, joint injuries, joint injections, for example, or specialist services provided by the practice, or even potentially the best person to see in the practice, i.e. asthma review. Let's get you in with our asthma nurse. Am I right in thinking that?
Yes, absolutely right. So that forms part of the intelligent care navigation system, and that's the reason we build everything right down to surgery level. We understand the nuance. We deployed 3,500 phone systems over the last couple of years. We configure all of your X flows for you. We know how you'd like to work and how you want to work, and it's important that we build the intelligent care navigation system around how you work as a surgery, not only your patient demographics, but again your workforce that you have available. So yeah, skills matching is really important.
Cool. Okay, so we've covered a lot there. Anything else that you wanted to show us today?
There was one more that I was going to show. And I'll just bring that up. And again, it just speaks to is that sharing, Hussein? Sorry.
I'm bringing it on right now.
Lovely, thank you. It just speaks to the customization. So I've increasingly over the last 12 months, I've talked about kind of deeply integrated is one of our core focuses at Exxon Health, and we know that. Highly customizable. Absolutely, as you can see on screen, you can customize everything that your voice agent might ask, every response your surgery assist, digital assistant might give, or how the request might come in, but also easy to use. So using the Surgery Connect Xflow in the back end, we've got the drag and drop tiles. So you'll be able to drop any of these agents into your call flow, ensuring that your patients have the choice. The nice thing about the way that we've built Xflow is follow-on actions. So within the chatbot interface, if you have a conversation, there's always follow-up actions at the bottom, whether you'd like to contact the surgery and request a callback, whether you'd like to go back to the main menu. And it's really important that we build that follow-up action in the agents as well. So, for example, if a patient calls into the surgery and they speak to the surgery assistant, which is the voice surgery assist, and if we use the notion of wanting to lose weight as another example, patient suggests they want to lose weight. Of course, it's via the phone, so surfacing a URL link isn't very helpful for a patient calling in. But what we can do within that agent is actually say, there is a local service at the PCN, they're running a 12-week weight loss program. Press 1 if you'd like me to forward the call to that service, or press 2 and I can send you a self-referral form. And we can then automate the SMS as a follow-up action to the patient. So it's all about not only understanding the patient pathway, but making sure that it's a closed loop so that they're not lost in that journey. And we can do that with each of these tools when they're put together.
Awesome. So then that allows the patients to then take control over how they may want to manage their healthcare aspects. I mean, by the sounds of it, that will also integrate potentially with what the practices have, obviously in terms of PCN services, neighborhood services, INT services, whatever you're calling it locally. I mean, everyone's got a different term at this moment in time for everything and things. But it sounds like that will integrate very clearly with those potential plans as we see them develop in general practice, but also making sure the patient has that. And that's logged as well somewhere, isn't it? As in terms of the practice to be aware that contact has happened and that, self-referral in the sense of provision of information.
Yes, absolutely. And actually, that's the latest addition to the Surgery Insights dashboard, which we haven't covered off today. But everything that's happening within your surgery around demand, so levels of demand, your call numbers, how many chatbot conversations happen in hours and out of hours, what's being asked, what isn't being answered, your NHS app data, how many prescriptions are being ordered through the NHS app. So we have all of your access metrics that are in Surgery Insights, but we also have right down to those individual signposts that occur, and then we're basically giving you data dashboards that show you how often you've referred to other services or how often patients have self-referred to those other services as well.
And I know often, when I go to speak to people about the way that technology is going to change general practice, data is the key one. Having that data, and I think for me, the way that Exxon Health is providing you that integrated level of data in terms of your call volumes, your access levels, what people are looking for, that helps hopefully practice to develop the services that not only they need right now, but also potentially how they plan for the future in terms of capacity, output, demand, all that kind of stuff as well. So that for me sounds great.
And that's increasingly the more frequent tab that I'm spending time on with our partners at the moment is the workforce and patients tab. So we can monitor through the Surgery Insights dashboard how many patients a full-time equivalent GP would be looking after, and also we mirror that with the full-time equivalent admin staff. And I'm spending 10 to 15 minutes with surgeries looking at this to understand, right, do we have sufficient capacity to handle this demand? Is it sustainable? And more often than not, there's a housing development being built. They're anticipating a surge of patients registrations, so they might, again, looking at this data helps them hire ahead of that to make sure that they can manage the demand or the influx of demand. I say hire, they may then look towards Surgery Assist, for example, that can, again, manage that demand. So yes, absolutely, the data is there to support your procurement decisions at local levels.
Okay, so we're going to go to the questions that we've got from people joining us. We've covered a couple already, so definitely going to come to some of these questions. And I guess the first one that we've got, it has a bit of a theme, and it's a theme that pretty much gets asked on every live stream at the moment, and that's around data governance. So I think it was, let me bring it up actually. So Ketan that mentioned this earlier, there we go. So is the voice agent using AI to complete forms, or is it filled in ad verbatim, as this would change whether it's classified as a medical device? And I know this is the big question that happens with a lot of technology at the moment, the question of medical device, what level is it, etc., security. What are your thoughts, Max, in terms of where you're at the moment?
Yeah, absolutely. That's a great question, Ketan. I imagine that was on lots of people's lips or fingers as they were watching the demo. So the Omni-Consult voice agent that you saw today does no summarization of the patient input. So it's a very simple speech to text model that just basically, as you say, verbatim takes what the patient says and completes it into the form. One thing that we didn't demo was actually my conversation with the voice agent. So after every input, the agent will just confirm that that's what you meant before you then submit it to the form. Obviously, when it's visual in a text, we just not summarize it, but we give a total summary of what's been said, and you press the button and submit it. In voice, we ask that after every question. So at the moment, the agent that you saw demoed today doesn't do any summarization. It is not classed as a medical device. But with the roadmap of this year, that's absolutely the direction of travel to ensure that we can build the most effective and efficient agents or workflow agents for your setting.
And if I remember rightly, obviously the Surgery Intellect is in partnership with Tortoise, which, correct me if I'm wrong, I forget if they are or are about to be classified as a Class 2 medical device.
About to be, I believe, is the correct answer. Yeah, about to be class 2.
Yes.
And yeah, I would point anybody that's interested in kind of AI and hallucination rates and monitoring, point everybody towards the Tortoise Shell that launched last month. I don't know whether we've got a link that we can pop into the chat, but yeah, Dom and his team at Tortoise have done an incredible job of not only recognizing hallucination rates, but actually mitigating as much, and I believe achieved the lowest hallucination rate of any AVT tool that's in the market currently.
And I believe you're covering some of that at your upcoming roadshows that you have, haven't you? Now, I have put the links to those down below, so if you do want to have a look at them, feel free to do so. I know that you guys have one in Nottingham, which is in a couple of weeks. Frustratingly, I'm not going to be there because I'm having to stay in clinic. Yes, I still do clinical work. Everybody would be surprised how much clinical work I do. But I know that these roadshows are really great for giving people the opportunity to have a look at that, and also covering a lot of that data governance that comes with it as well, don't they?
Yeah, I had the pleasure of joining the event in London just before Christmas. We did Manchester before Christmas. I believe the next one is Reading on Friday. We've got Bristol, Newcastle, and of course Nottingham. So yeah, if you click the link, we have each event that we're hosting, and it's actually presented by Dr. Dom Pimenta, the founder of Tortoise, who runs through exactly all of the evaluation models and how they make that it's safe, secure, and compliant.
Mm-hmm. And I guess you may have people who are currently using Exxon but haven't fully realized the full suite of what is available. I guess for those practices who are currently thinking, I'm not sure if I'm getting everything I could do out of this tool, how would you recommend they look at that? And then I'm going to come on to the other people in a second.
Yeah, absolutely. So again, there's kind of 4 core products, if you like, or tools. So Surgery Connect, Surgery Assist, Surgery Intellect, and Surgery Insights. And within those, you've got multiple features that could be turned on or off according to your needs. So the first thing I would do is if you are an Exxon customer, or you aren't an Exxon customer, but if you are, you could book in some time with your customer relationship manager. So your account manager within Exxon Health, book in a discovery call to look at and audit or evaluate what you've got and what you haven't got. And what we will typically do with you is actually bring up Surgery Insights for your surgery. So we actually give you a kind of a sneak peek into all of the data, and then from that we tend to make decisions. So we can see that you might not have the callback request solution switched on, or you might not have automated check and cancel switched on, priority caller routing. There's so many features within Surgery Connect that we can just toggle on. We just want to work with you to make sure that it fits with you and your patients. If you're looking to request, and again, those conversations may lead to, okay, maybe we do need to look at Surgery Assist or bring Intellect into the consulting room for the GPs, and we just have that conversation. But again, as you said, Hussein, and rightly so, all of those conversations are led by the data. So Surgery Insights is an incredible tool because we can use that data, talk to you and discuss it with you, obviously discuss any anomalies or outliers, if you've lost a member of staff and so on. But it's really important that we have that open discussion with you and then plan a way forward.
Mm-hmm.
More often than not now, we're looking at kind of digital strategies across the next 1, 2, or 3 years with our partners. And I think that's really important that, yes, part of your solution with your mixed economy of digital tools where you're struggling to audit patient journeys and they might be dropping out of the loop and presenting at the hospital and so on, we really do want to reduce that. But we understand that some of those tools are funded locally, whether it's the ICB or nationally. And we understand that you might not want to put your hand in your pocket, or you might want to look around for funding. So it's not like you have to adopt everything all at once. And we want to bring you on a journey with us to help you get to the most efficient way of working. Once we solve digital inefficiencies, we then look at human efficiencies within the surgery. And it's amazing. I'm working with some surgeries at the moment. We've kind of freed up 2 full-time roles within the surgery. and now they're focusing on preventative and proactive care. And I talk a lot about shifting general practice from a reactive to a proactive care model. And it's really just, it's why I get up in the morning. We can actually do that and deliver better care, improve the health of the nation by doing our call recalls with our surgery, having the time to do it, not panicking towards the end of the year for cough, for example.
Okay. And I guess if people are thinking about looking at using the Exon tool, obviously there's a variety of different things that we've just talked about. So you've got your people who are already on Exon Health looking at potentially using Assist or looking at using Insights or Intellect, etc., and then people who are coming to Exon fresh. How would you describe the different onboarding processes that would be involved in those journeys? Because I appreciate it. There's a variety of different permutations there. But also, what would the practices potentially need to do beforehand to help bring down that onboarding time? I'm also chucking in there, obviously, there's the integration with IT teams and the other kind of stuff that sometimes can slow some of this down from your experience and things.
Yeah, so I'd like to say I'm a digital transformation consultant by trade, if you like. When I first came into healthcare, I was part of a consulting business, digital consulting business, where we worked with surgeries. We really did, live and breathe it. Worked within the waiting room, and then went into the meeting rooms and discussed, right, what's wrong. So we'd really do a full audit of what the problem is and how we work and how we solve it. So I completely get the pain of deploying new digital solutions. And I think joining Exon Health at the back end of 2024, it was something that we really wanted to bolster. And I think from the old consulting business that we had in Hanley Consulting with Sharon Hanley, Ellen Gatlin, my sister-in-law, not wife, part of what we believe we brought was the ability to make sure that there isn't that pain in deploying these new solutions. And again, our customer success team has done a fantastic job. All of the deployments that they've done of Surgery Connect, deployed 3,500 phone systems in the short space of time that they did in recent years. So if you haven't already got the solution, we've got very, very good processes in terms of getting that out. It varies, of course, with what you're adopting. So if you're deploying a new phone system, there needs to be a site survey and evaluation of what you've got in place, actually, in terms of physical cabling and hardware and so on. And then it's a case of just looking at the patient workflows and Xflow, number of staff in your team. So I believe it could be 1, 2, or 3 months to deploy Surgery Connect. Surgery Assist is very lightweight in that a lot of the information is already there. So a lot of PCNs have done, they've got their Bibles, their care navigation Bibles, for example, and we can bring all of that data into Surgery Assist. We looked at integrating with Directory of Service, the DOS, to speed up deployments. We recognized as we did that regionally that there were some slightly outdated services in there. And one of the things that we've actually created within Surgery Assist is any third-party link that we signpost a patient to, we've got automatic alerts if anything changes on that page that we signpost to. And that raises a ticket with our team to then review it to make sure the patient doesn't have a broken journey.
Okay.
So we do a lot of work that we take off the surgery to kind of build out the prototype of the digital assistant. A Surgery Assist chatbot will be built within 2 weeks, ready for testing and back to you. And then it's the ongoing maintenance of all of the training data. Again, it's all automated, and we keep our finger on the pulse there. And Surgery Intellect, it's very quick. If you have got the phone bar and you're using Exon Health's Surgery Connect system, we can switch it on. But of course, we do like to take you through the clinical safety training through our academy as well, which is a huge help. So I think, to answer your question, it's varied in terms of what you deploy, but what you could do to prepare is understand what you might need and where you want to go. And I think that helps the initial kickoff meetings and conversations that we might have, because a lot of the time you might think that you want that, but that's not what you need. You're already paying for something over there. Then we can just change the plumbing and tweak a few things to really unlock some benefits.
Sure. And I guess I often ask people when they come onto the channel about costs and stuff in terms of helping general practice understand that. Now, part of the challenge we've got in this particular situation, you've got so many suites of options. I'm not going to specifically ask Max to go through that because I think it is unfortunately quite nuanced. And I think there is aspects of that very much people probably do need to speak to you directly, because there is that different levels of where you go. And then you've got practice size, installations, all that kind of stuff that does change it. I know that you have a specific team that help practices understand those costs, and absolutely, I'm assuming there's a difference based on population size. So, practice, PCN, wider, etc., and things. But if people did want to have that conversation with you, where's the best place they do go to do that?
Yeah, and I think that's a really good point. So as with everything, we've just kind of just worked out all of the kind of bundled pricing, if you like. So there is the ability that the more you build out this intelligent care navigation system, I mean, we encourage everybody to kind of think about delivering intelligent care navigation within their setting anyway, whether you're using 100% Exxon products or whether you're using a mixed economy of them. It's important just to think what we've covered today will really benefit your staff and your patients. So hopefully, if anybody takes anything away, it's to really think about delivering intelligent care navigation. The more that you do deploy Exxon Health tools, and you do get deeper integration across those, so sometimes it's not possible crossing between systems and patient pathways, but where you do, of course, because it's all within our ecosystem, there's lower costs. We don't have to cover API costs sending data around. It's all within one place. We've got one way to verify patients. We've got one request to callback. We've got access to all of the same APIs that we utilize across the system. So therefore, we don't need to pass any further cost onto the customer. So usually, typically, if you've got more suppliers, you'll have more cost. So what I would say that as you do look to build out the intelligent care navigation system, there are savings to be made. But again, as you're right, Hussein, there's probably a conversation that we would have with you, because we appreciate the strain you're under. We appreciate you want to be cost effective. And there may be some times where actually it won't cost you anything to make a quick change and add some value.
So where's the best place to go to find that out?
There's a link in the form to register your interest for to deliver intelligent care navigation. You will see in the first question, we'll ask you which part of the system that we've discussed today would you like to discuss. That is a multi-select. You could select multiple of those. What that will do is then put you through to either a specialist consultant that can work with you on that. Usually it'll be a 45-minute to an hour initial discovery call. And then it's nice potentially to have a follow-up after we've looked at your data to identify and discuss the best solution for you.
Mm-hmm. So that link is down in the chat if you're watching us on the live stream and stuff. So that will be there. I will pin that to the YouTube video as well. So when we've finished, you'll be able to access that link to that form that Max mentioned. I also know that you guys are at Best Practice London, which is in a few weeks' time, aren't you as well?
We are, yeah. We're doing the 2 days. So the Intelligent Care Navigation System, we first launched in October last year in Birmingham. Anybody that was there saw the big Intelligent Care Navigation System. And what we've done is it's very interactive, as always. So we've got different pods and stations for different parts of the system. So actually, if you don't utilize any of it and you'd like a full walk around, we could do a tour across around each pod and show you exactly how each part of the system works that we've done today. So super excited to welcome everybody there. And we've also done a very exciting interactive engaging way to basically let you tell us what you'd like us to build. So please do pop along. There might be QR codes. You'll need to engage. We'll be doing a talk as well, of course. But yeah, we do want to hear from our users and other people working within primary care and tell us what would be most useful to them. Because as I said, there's lots of technology and we have the ability to build lots of things, but we want to deliver the most value to the system. So yeah, please do come along and get involved.
Absolutely. So if you want to contact the team, use the link down below. It'll either be in the chat or on the pinned comment on the YouTube channel. Alternately, catch them live at Best Practice London or at their event in Nottingham or elsewhere on the Roadshow. As ever, if you want more information, let us know down below. If you want to check that more detailed view of the surgery Intellect and watch that comparison webinar that I did, the link to that is probably coming up right here. And as always, we'll be here to take and answer primary care and learning. Thanks a lot, Max. We'll catch you.